Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Nature has played a vital role in the development of cancer therapies. For example, Taxol, which was originally formulated at the University of Kansas School of Pharmacy, is derived from the bark of the Pacific yew tree. This challenging yet exciting field of research holds great promise as we look for better ways to preventing the development of cancer. Good morning, I'm Dr. Roy Jensen, Director of the University of Kansas Cancer Center, and joining me this morning are two of our esteemed breast cancer researchers, Dr. Fabian and Dr. Fariba Behbod, who both study the use of natural compounds to prevent breast cancer. Cameron Poindexter is here as well via Skype to take your questions. Well, first of all, I want to welcome you both. Dr. Fabian, you are always looking for ways to exploit nature's bounty to really improve how we treat and prevent cancer. How did you become interested in this type of research?
Well, I became very interested in prevention research in general because that's what my patients are interested in. Women are also more interested in ways that they can themselves reduce their risk of breast cancer other than taking a pharmaceutical product. And as you know, there's multiple chemicals contained in vitamins and a wide variety of foods that both in animal studies and in epidemiologic studies seem to reduce the risk of breast cancer.
Mm-hmm. So I've always found it interesting that there are far more drugs to treat breast cancer than there are to prevent breast cancer, or really any kind of cancer. What that indicates to me is that there must be quite a few challenges around developing prevention agents, and maybe you could tell us a little bit about why that is and what you're trying to do to overcome those challenges.
Well, traditionally, the way that we determine that a particular agent, be a drug or natural product, reduces risk for breast cancer is we line up 10,000 women, randomize half of them to get the drug and half of them to get no treatment or a placebo. And then we wait for a couple of decades and see what the difference is in cancer incidence. That is an extremely time-consuming and very expensive process. And you certainly cannot develop natural products or test vitamins or chemicals in foodstuffs and be spending millions and millions and millions of dollars trying to do that. The drug companies also have very little interest in testing natural products for breast cancer prevention. On the other hand, for cancer treatment, you just give the cancer patient a standard treatment versus the new treatment. You only have to have a few hundred patients usually and a few years to determine if one treatment versus the other is best. So prevention gets shortchanged.
Yeah. So you just wrapped up a preliminary study that was focusing on the use of omega-3 fatty acid supplements. And that study, as I understand it, was for women that were at increased risk for breast cancer and undergoing a weight loss prevention. Could you tell us about that project and
Sure.
what the results were?
Well, because of the problems in prevention that you mentioned, and it takes so many years to actually see if one treatment versus another reduces the incidence of breast cancer, researchers, clinical researchers, have teamed up with researchers like Dr. Behbod, and we first look in animal models to see if a certain dose of that natural product or agent reduces cancer development in an animal model. And even more importantly, what markers, proteins, or genes are changed in the animal model. Then we take those genes or proteins, we call those biomarkers, into the human trial. And instead of trying to look for changes in cancer incidence, we initially look to see if there are changes in these biomarkers that predict that an individual is or is not going to develop breast cancer.
Mm-hmm.
And that's exactly what we did in the trial that you're referring to. Omega-3 fatty acids are commonly found in a variety of places in nature, but in very high doses in cold water fish like salmon, herring, mackerel, things of that nature. We don't eat a lot of mackerel, herring, and salmon in the United States. So people have fairly low consumption of omega-3 fatty acids. Omega-3 fatty acids are anti-inflammatory, and they also really help normalize signaling in a lot of our body organs like breast tissue, colon, and other organs that are high in fat content. We felt that some of the changes that occur in obesity that predispose to breast cancer development might not only be helped by weight loss, but also by adding omega-3 fatty acids onto that weight loss.
Mm-hmm.
And in fact, that's what we found. That women, and these were postmenopausal women at increased risk for breast cancer who were overweight, we started them on a standard weight loss intervention. Half of them lost at least 10% of their body weight by 6 months. We had also randomized these women to omega-3 fatty acids or a placebo. Those women who were randomized to omega-3 fatty acids had much more dramatic improvement in these risk biomarkers than the women that didn't. Further, women who both lost 10% of their body weight and who were randomized to the high-dose omega-3 fatty acids had hands down the best response as far as these biomarkers were concerned. So we're very enthusiastic, and we would like to see this kind of a trial, weight loss plus or minus omega-3 fatty acids, put into a larger prevention trial situation.
Mm-hmm. So it's interesting that weight loss was such a critical part of your study. How does it work that obesity has such a big influence on breast cancer risk?
Well, when we think about obesity, just like you mentioned, we think about weight, but actually it isn't the weight. Actually, it's fat, and it's particularly fat in a certain place. So it's fat around your internal organs, it's fat in your liver, it's fat around your heart. It's fat in places fat shouldn't be. That causes the problem. And what happens is when this fat, we call it visceral fat, on television a lot of times it's called belly fat, but that's really kind of a misnomer. So this visceral fat is not as expansile, if you will, as the peripheral fat, the fat on your thighs or hips or arms. And so the fat cells get crowded, and when they get crowded, they are not happy, and they just don't work as well. So they put out abnormal amounts of these hormone-like substances called adipokines and cytokines, and this causes a chronic state of inflammation in obese individuals. This chronic state of inflammation causes what we call insulin resistance, so our insulin body levels of insulin rise, and this stimulates cancer cells or precancerous cells. And as far as breast cancer goes, it also elevates the body's hormones. So the inflammation, the insulin resistance, and the elevated levels of hormones all work to increase the risk for breast cancer. So reducing weight, but in particular reducing this visceral fat, through not only diet but also exercise, dramatically improves all these processes.
So, Dr. Behbod, you have studied a particular type of breast cancer. In fact, I guess both of us have. Ductal carcinoma in situ, or DCIS. And I'm not going to say how long I've been doing it, but you've been doing it for quite a while as well. Tell us, what is DCIS?
DCIS are also referred to as stage 0 breast cancer. In stage 0 breast cancer, cancer has not spread outside the milk tubes or breast ducts. However, when stage 0 breast cancer spreads outside the milk tubes or even elsewhere in the body, then they're referred to as invasive or metastatic breast cancers. Studies show that only less than 50% of stage 0 breast cancers, if left untreated, not even with surgery, that they will eventually advance into late stage or metastatic breast cancers. However, right now we don't have good information to be able to categorize patients into high risk or low risk. Because if a lesion is low risk, then it's possible that women can use less harsh treatments or avoid treatments altogether.
So, if you're just joining us, we're here with Drs. Carol Fabian and Fariba Behbod discussing their research of natural compounds for the prevention and treatment of breast cancer. And Cameron Poindexter is here via Skype taking your questions. And I understand, Cameron, that we already have our first question. So what do we have?
Yes, we actually have two questions. The first question is, are there different kinds of omega-3 fatty acids? Is DHA a type of omega-3?
Great question. And the answer is yes. DHA is a type of omega-3 fatty acids. Just in general, without getting all involved in basic biochemistry, is some omega-3 fatty acids come from primarily plant sources, and they are, in many animals, converted into things like EPA and DHA. Human beings can't do this conversion very efficiently, so it's much better for us to actually ingest the DHA or the EPA ourselves, and we do that best either by eating marine type of fish or taking fish oil supplements or things that are made to be like fish oil supplements. Some of those, particularly for DHA, actually are made from algae. And in fact, that's how these cold water fish get so much DHA and EPA in their flesh, is they eat a lot of algae.
So if you think that other people may be interested in this conversation, please use the hashtag bench to bedside. And I want to go back to Dr. Behbod. One of your research projects on DCIS actually involves an herb that's growing outside my wife's kitchen. Maybe your kitchen as well. But tell us a little bit about that and kind of how that line of research came to be.
So in order to study the mechanisms by which some stage 0 breast cancers advance to the more aggressive types, we developed a model in which we take stage 0 breast cancer and implant them into animal models, in particular mice, and then we follow their natural evolution. And this way we don't harm the patients. And so by doing that, we found, interestingly, that very similar to human disease, only about 50% of stage 0 breast cancers advance to the more aggressive invasive breast cancers. And furthermore, we found that this expression of a certain genes, referred to as B-cell lymphoma 9, that was strongly associated with this advancement into invasive breast cancer. And then we also discovered that a natural compound referred to as carnosic acid, a major ingredient in rosemary extract, was able to stop the function of this gene. And so when we administered rosemary extract to our animal models, we found that it was very effective in prevention of this transition from stage 0 to aggressive and invasive breast cancers. And so based on our very promising results, National Cancer Institute has now provided funding so we can study the safe and effective dose of rosemary extract for prevention of stage 0 transition to invasive breast cancer in a larger set of patient samples. And if we're successful with our animal models, then we will move rosemary extract to the clinics where we can actually study an effective dose that can be used in patients at high risk for breast cancer to see whether rosemary extract will be effective for using in prevention of breast cancer in those high risk individuals.
Mm-hmm. So for quite some time now, antihormonal therapy has been utilized for women diagnosed with DCIS in an attempt to minimize their risk of going on to invasive cancer. But as it turns out, less than half of the women who are prescribed those drugs, wind up taking them long-term due to side effects. And so, the biggest issue is the fact that they cause menopausal symptoms. Dr. Behbod, how could your research project potentially change our approach to DCIS, kind of given this situation?
Yeah. So right now, a woman diagnosed with stage 0 breast cancer is receiving surgery in the form of lumpectomy, where a portion of the breast is removed, followed by radiation therapy, or entire breast is removed, also referred to as mastectomy. And in some cases, they're offered, like you said, antihormonal therapy. And we know, like you said, that antihormonal therapy are associated with a lot of side effects. This is the reason that the compliance is so poor. So if we understand the mechanism by which some of the stage 0 breast cancers advance to the more aggressive invasive breast cancers, then we can potentially prevent overtreatment for low-risk patients. And for high-risk patients, develop therapeutic strategies that are safer and more effective, such as rosemary extract, for prevention of invasive breast cancer.
Mm-hmm. So I want to introduce yet another natural product that has been studied at the KU Cancer Center by you, Dr. Fabian, and that's Lignans. And these are compounds which are found in high concentration in flaxseed. And could you tell us a little bit about their use as a breast cancer prevention strategy, particularly in premenopausal women?
I think the reason that lignans, which again are found in high concentrations not only in flaxseed but all kinds of oily seeds like sesame seed, pumpkin seeds, things of this nature, which also, by the way, those seeds have a high concentration of plant-based omega-3 fatty acids. But lignans have captured the imagination of a lot of people, mainly because in countries where there is a high lignan intake, there appears to be a reduced incidence of breast cancer in the women that ingest naturally lots of lignans versus those that don't. And once again, in the U.S., we don't ingest much in the way of lignans. So could lignans be a preventive compound? In premenopausal women, they seem to have a mild anti-hormonal effect, not enough to give you menopause symptoms, but a mild anti-hormonal effect, perhaps preventing an overshoot of hormones during the menstrual period. They're also anti-inflammatory. And remember, we think it's both hormones and inflammation that increase breast cancer risk. So honestly, that was why I was so interested in this. However, a lot of women love to put flaxseed and these other seeds in their food, their smoothies, their cereal, all kinds of things. And there is also concern that peri and postmenopausal women, these substances may act like an estrogen. And so in the lay literature, there's a lot of information that you should be careful about eating soy, flax seeds, or any kind of plant estrogenic-like substances. So we did, after a positive pilot study, we did a randomized trial in premenopausal women. Again, for about a year, they took Lignans in a dose that you could easily get over the counter versus a placebo. And what we found is it extremely well tolerated. There was no indication that there was any problem in the breast tissue or anywhere else by taking Lignans. And in fact, in patients where we were able to get a very precise measurement at the same time as their menstrual cycle, there appeared to be a reduction in cell growth in the breast tissue. So we would like to take that finding and then move it on to other research.
Maybe before we go on, we should just clarify that none of us own a supplement company, so
We don't know anything.
we're not trying to hawk anything here. And kind of on that topic, taking more supplements, putting more rosemary in your recipe won't necessarily reduce your breast cancer risk, but maybe tell us a little bit about what steps women can do to reduce their risk. And, you've started one of the first breast cancer prevention clinics in the country. Tell us about your advice in that regard.
Well, I think step one is to know what your risk is, particularly women who have a family history or women who've had a prior precancerous biopsy are oftentimes at increased risk. So know what your risk is. Most women who think their risk is very high are actually what we call a moderate risk for breast cancer. Mm-hmm. Not average, not high, not real high, but moderately increased risk. And for these women, generally what we recommend is possibly an increase or earlier screening. For example, for most moderate risk women, we recommend starting screening 10 years before the youngest effective relative. And we also may advise doing a breast MRI in addition to a mammogram, particularly for women with dense breasts. So that's number one, know what your risk is. Number two, if you're at least at moderately increased risk, you may need earlier screening and more screening. Number three, if your risk is simply moderate, we really advise mostly healthy behaviors, not taking antihormonal drugs like people with DCIS are advised to take. And those healthy behaviors are exercise, and more exercise, really up to 5 hours a week of moderate intensity exercise. And that will prevent the next thing, which is weight gain. We don't like women to gain weight. Eat a good balanced diet that include 5 servings of fruits and vegetables per day. And that 5 servings of fruits and vegetables per day should include a lot of these things that we're talking about as natural products. Also, unless there truly is a real need, avoid, if you're peri and postmenopausal, taking the combination of an estrogen and a progestin. Estrogen itself, only estrogen itself, which women without a uterus can take, is not going to increase risk. It's estrogen plus progestin. Did that answer your question? Okay.
There you go. So, Dr. Behbod, you worked at the Baylor College of Medicine before joining us. Could you tell us a little bit about the factors that influenced you in terms of your decision to come here?
Yep. I myself was diagnosed with stage 0 breast cancer, or DCIS, back in 2004. At the time, I was a postdoctoral fellow at Baylor College of Medicine. And when I finished my training, I wanted to focus my research on studying stage 0 breast cancer. So I was looking for a good home for my research so I can start my own laboratory. I actually had 2 job offers in Texas. And a lab mate of mine, she was a PhD student at the time, and she was from Kansas. And she encouraged me to apply to University of Kansas. And so when I came here, I spoke with both of you, Dr. Fabian and Dr. Jensen, and Dr. Thomas, who was the chair of our department. And I was convinced that I would have the highest support for my research studying stage 0 breast cancer right here at the University of Kansas. Another big factor was 2 of my mentors who have Dr. Craig Allred and Dr. Dan Medina, who have devoted their entire life to prevention of breast cancer. They told me that University of Kansas is top, #1 in clinical and translational breast cancer research. And so those 2 factors made me turn down my offers in Texas, actually, and come to the University of Kansas. I've been here 12 years. The support for my research has been tremendous, has been beyond my imagination. Because of this support that I have received, not just from the Cancer Center leadership at University of Kansas, as well as the clinicians, the pathologists, the radiologists, and the surgeons at the University of Kansas, but I receive support from other institutions. Dr. Mirata's group at St. Luke's, Dr. Ritchie's group from Truman, as well as surgeons in Wichita, Dr. May, Dr. Kusik, and the pathologist, Dr. Razek. So because of all this wonderful support that I received for my research, we have been able to develop a model that has received worldwide recognition, not only for studying stage 0 breast cancer, but all stages, including invasive and metastatic breast cancer.
Yeah, that's awesome. Well, we're certainly glad to
Thank
to
you.
hear that. Cameron, it sounds like we have another question.
Yes, we actually have a few questions. The first question is, how much omega-3 should an individual consume daily? And is there a certain over-the-counter fish oil supplement you would recommend?
Oh, boy.
A loaded question. To really get the preventive benefits of omega-3, you probably need to, the preventive benefits as far as breast and colon cancer are concerned, you probably need to take around 3 grams of the combination of EPA plus DHA per day. As far as over-the-counter preparations, whether it's krill oil or fish oil or whatever, you have to look at the amount of EPA plus DHA on the bottle. And that usually means you're going to be taking about somewhere between 4 and 6 capsules of these over-the-counter medications per day to get to that amount. If you really like salmon, the other thing you can do is just eat a huge piece of salmon once a day. But most people don't like salmon that much. It may be that if we had better lifelong consumption of omega-3 fatty acids, that maybe 1 or 2 of those omega-3 fatty acid capsules that you can buy over the counter would be enough. But there's just a lot we don't know yet.
Next question, Cameron.
Yes, they want to know, what are your thoughts to metabolize and balance estrogen like DIM?
What?
We didn't get the last part of the question. Metabolize and what estrogen?
And balance estrogen like DIM, D-I-M.
Like dim.
Oh, I think that is, I am not sure what BIM is. I think that is a very old compound. If the person who asked that question could email us, I will answer that directly. I am vaguely familiar with BIM. The chemical that it is derived from many years ago actually was studied here as a possible cancer treatment or preventative. My direct answer to you is we really do not know if that is of value or not. And right now, I would not try buying that over the counter to counter out any estrogenic risk.
Any additional questions, Cameron?
Yes, the next one is, have you found any supplements that might help the side effects of anti-hormonal medication, specifically letrozole?
I didn't hear the last of it.
Any supplements that can counteract the side effects of letrozole?
Well, I think anyone who takes letrozole in addition to hot flashes, and it's not just letrozole, any of the aromatase inhibitors can do that, may have not only hot flashes, but also fatigue, an increased risk of joint stiffness, joint aches and pains. Number one, you need to make sure that you have an adequate level of vitamin D. That may not help the menopausal symptoms, but that may help prevent the joint stiffness. Number two, there are a couple of things that are prescription drugs actually that can help with hot flashes, whether it's from tamoxifen or the aromatase inhibitors. And that includes an old drug called gabapentin that you can take at bedtime, as well as some of the drugs that are antidepressants. I think it's not a supplement, but another thing that you can do to reduce fatigue as well as joint stiffness from letrozole is make sure that you're getting plenty of exercise. And again, it doesn't have to be vigorous exercise, but get in your 10,000 steps a day and make sure that you're actually getting both strength training as well as cardiovascular exercise.
So we're approaching the end of the episode, and I want to hear from both of you in terms of the key takeaways for our audience, and hopefully that'll give folks a little bit more time to maybe get their final questions in. We'll start with you, Dr. Behbod. What would be your key takeaway?
So I always hear from friends and family that they have read about a natural product to take to stay healthy or to prevent cancer. And my take-home message is that make sure that appropriate studies have been done and a safe and effective dose has been found, not only with animal studies but with human studies before you start taking any supplements.
Mm-hmm. Dr. Fabian?
I don't really have much to add to that. Oftentimes where these studies get started, particularly things that we see reported in the lay literature, are they see things that happen with people with a severe deficiency, whether it's vitamin D or something else. And there really is very little information except with possibly a few things that we're trying to study in a scientific manner, that taking supraphysiologic doses of any supplement is helpful. And in fact, in some cases, it can be harmful. Several decades ago, people were taking large doses of beta-carotene, carrot juice, and other supplements. Yep. And what they found was this could actually damage the liver. So we have to be really careful of what we do.
Yep. Cameron, it sounds like we have at least one more question.
Yes, I'm going to take two questions and combine it into one. They want to know, where is a reliable and quality supplement of omega-3? Where can you get it? And the second one is, what if you're a vegan? Is there any replacement for fish?
Okay, I'll answer the first question first. There are, I can't tell you right off the top of my head where to get it, but I'm sure if you go on either at Costco or Amazon, there are DHA supplements that are made strictly from algae, have no fish, that would be vegan. to tell you the truth, the most reliable supplements of omega-3 fatty acids are prescription supplements, but they're expensive. And there is Lavazza, which is routinely prescribed for individuals with high triglycerides. And there is a generic of Lavazza where you can get the amount of omega-3 that I was talking about with just 4 capsules a day. I think Costco has several very reliable supplements that are fairly concentrated, particularly in their krill oil. But I think the most important thing is when you buy a supplement, especially if you buy it from Amazon or someplace online, to make sure that you look at the reviews, how it is manufactured, and how much EPA and DHA are in the supplement. Those with higher amounts of EPA and DHA are a more potent supplement.
All right. Well, Dr. Fabian and Dr. Behbod, thank you so much for being part of this week's episode of Bench to Bedside. To learn more about breast cancer, visit kucancercenter.org/breast cancer. That's it for today. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.